Hello, I'm Dr. Anuradha, fertility specialist from Anu Test Tube Baby Center, Hyderabad. 43 years ago, a great revolution happened in the field of infertility. And that great event was the birth of first IVF baby. On 25th of July 1978, Louis Brown, the first IVF baby of the world, was born. And that marked a great event in the revolution in the treatment of infertility. And this day is remembered as World IVF Day, and that is 25th of July. This was not an easy task. There were great efforts, a lot of scientific research put in by pioneers, Dr. Robert Edward and Dr. Patrick Steptoe. It was a great effort through them, and it brought revolution in the treatment of infertility. And since then, there's no looking back. Dr. Robert Edwards was awarded Nobel Prize for his contribution in the field of reproductive medicine. We were fortunate and honored to have Dr. Robert Edwards with us in 2002. And in fact, he actually spent a whole day with us and explaining about the whole treatments, and he was very happy with our clinic and the setup. We started our IVF unit in Hyderabad in 1994 in collaboration with Midland Fertility Services from England. The fascination for me on IVF and the fertility treatments drew me towards this kind of a treatment, and I wanted to gain some knowledge in this field of infertility. Fortunately, I could get trained under Dr. Peter Bromwich and Dr. Andy Walker, and me and my embryologist, Dr. Prasad, also got trained under them in 1991, and we started our IVF unit in 1994. I'm very happy to say that we had the first IVF baby of Andhra Pradesh in 1995 from our clinic. In last 27 years, we have seen evolution in IVF, and we witnessed it. Those were the days when even procurement of the drugs, the consumables, the chemicals, laboratory media was very tough. We had to actually bring them over by ourselves from different countries. Now, it has become much easier. Starting an IVF clinic or procurement of all those has become more accessible. The drugs used for stimulation for ovaries were extracted from menopausal urine. Now they have become more purified. We get highly purified drugs and more effective drugs, recombinant drugs, and they are more safer. So the technology has definitely improved. Most importantly, the social stigma is comparatively less now. In those days, men either never used to come to the clinic, or if they were in the clinic, either hiding under the trees or behind the walls, and we had to really search for them. Now we all know that it's not a fault of women. 30% of the problems are because of the male infertility, 30% because of the subtle defects in both the couples, and in 10% it's all unexplained. That means all the tests are normal, but still there is no conception. In those days, couples did not even want to disclose that the baby was born through IVF. But I am very happy to say that the babies born through IVF in those days, they're coming back to us with natural pregnancies and bringing their babies to us. And it gives an immense pleasure in seeing 2 generations in our clinic. Now times have changed. The couples themselves come for treatment and even request for IVF early. Now the IVF has become more streamlined and more evolved, and it is a treatment with a higher success rate. So let's see what is an IVF. Let's see how the IVF story goes. Normally in an IVF procedure, which is also called as a test tube baby treatment, the eggs are taken out from the ovary of a woman. They are fertilized with the husband's sperm outside in the laboratory, and the embryo is put back into the uterus after a couple of days. So the embryo in fact develops in the laboratory for 3 to 5 days, and afterwards it has to go into the mother's womb to develop. So previously the myth was that a test tube baby means that the baby actually grows in the test tube. It's not so. You cannot develop an embryo beyond 5 days or maximum 6 days in the laboratory. There has been a research going on, and in UK they could grow embryos up to around 10 to 12 days, but it's still a research and the embryo has to go back into the uterus. So it's not that the baby is growing in the test tube, but it's happening in the womb itself. So the procedure of taking out the eggs is usually a simpler procedure. It's done transvaginally using an ultrasound guidance, and the eggs are retrieved from a follicle. Follicle is a place where the egg grows. Egg is actually microscopic. You cannot in fact see an egg on the scan. So once you aspirate the follicular fluid, this is looked under the microscope to identify, and then it is cultured along with the spermatozoa in the laboratory. So the incubator where it is cultured is like a human body, where the temperature and the nutrition is maintained. Earlier days, this recovery was done under laparoscopy. So now at least it has become much simpler, much safer and less invasive. So once the embryo is developed, it's put back into the uterus using a simpler method like using a soft catheter for embryo transfer. And earlier it was a blind technique, but now we use an ultrasound, and it's under ultrasound guidance that transfer is done. In the laboratory there is a lot of procedure, and it all depends on how many eggs you get and how many embryos. Not all eggs develop to the stage of embryos. There are some which get fertilized, and there are some which develop up to an embryo, and there are only few which go up to a stage of blastocyst, which is a day 5 embryo, and this is the final stage where it has to go back into the uterus. You would have seen triplets, twins in those olden days. We know there is an increased risk of problems during pregnancy and for the babies with multiple pregnancy. We also had triplets and twins, but now the pattern is that you do a single embryo transfer and occasionally a double embryo transfer to improve the pregnancy rates. And so that makes a risk of multiple pregnancy lessened. So what do you do with the rest of the embryos if the women have developed more eggs? Then we do a procedure called cryopreservation, that is freezing the embryos. So the embryos can be frozen, and in fact if the patient does not conceive in the first cycle, then he can use those frozen embryos in the next cycle, so that the woman doesn't have to go through all those drugs, the procedure, and it can be transferred directly. And there are some women who luckily would conceive in the first cycle, and they would come back for a frozen embryo transfer for a second pregnancy. Interestingly, we had a woman who came back to us after 18 years, and we realized that we still had those stored embryos, and we did a frozen embryo, and fortunately, to our surprise, she conceived in that cycle after freezing embryos for 18 years. So that is the evolvement in the technology, the refinement in the laboratory procedures, which has improved the success rates to a great extent. So the concerns are, what is the safety of these procedures? Now the drugs have got refined. So the risks associated with the drugs have become lesser, it has become more efficacious. There were medical complications like ovarian hyperstimulation syndrome other than multiple pregnancy. So now the protocols have changed, they become more safer. And I am very happy to say that our clinic is a OHSS free clinic. So that means this risk of hyperstimulation, I'm sure I may not have seen for a long time now. So this has become much safer. And what is the success rate in IVF? So does everybody who goes through this treatment, spending so much of money, is going to conceive in the first cycle? No. This in fact has a success rate of only 30 to 40% in one cycle in the best of the circumstances. If there are problems, sometimes it can come down less than 30 to 40% per cycle. And again, age is also very important. This is for women below the age of 35. From 35 onwards, the chances are lower, the risk of miscarriage is also higher. And from 37 to 38, in fact, the pregnancy rates get half down. And it is surprising that at the age of 40, even if they have a good response, the pregnancy rates are no beyond 10% per cycle. But don't get disappointed. Each cycle gives a chance of 30 to 40%, but if you try more number of cycles, it is called cumulative pregnancy rate. The pregnancy rates go up to almost 80 to 90% by the end of 3-4 cycles, which is something good. Most can actually achieve with multiple cycles of IVF. But how many can actually go through so many cycles? So It need to be individualized depending on the patient's circumstances. And if in case a couple does not conceive in a regular IVF cycle, what are the options they have? There are alternate options, which is called third party reproduction. So if there is a problem with the eggs, problem with the sperms, or problem with the embryos, then you can think of options like a donor egg, a donor sperm, or a donor embryo. This at least gives a feel of motherhood to the woman who is going through this kind of third party reproduction. And there are options like surrogacy in case there is a problem with the uterus, history of recurrent miscarriages, or there are some medical complications. Surrogacy means substitution or renting another woman's womb. So this in fact gives them a genetic child. Even if it is not possible for her to bear the baby, at least she can have her own genetic child through a surrogacy. So these are the possible alternate options if in case a couple does not conceive with standard IVF cycles. Now this IVF has been going on for the last nearly 4 decades, and there's been lot of refinement, and there are other advances also to improve the success rates and reduce the risks. One of them is pre-implantation genetic testing. So that means once the embryo develops to a stage of blastocyst on day 5, few cells are taken from an embryo and they are sent to a genetic lab where you can assess the genetic integrity of an embryo. And if there is any abnormality, then those embryos are not used and you can go for embryos which are normal. So this improves the pregnancy chances for that particular couple, and also in couples where there is a risk of hereditary abnormality passing on to the child also can be eliminated. In these, the embryos are frozen once you send the cells for the laboratory, and they will be used as a frozen embryo cycle in the later cycle. But this again has to be done in selected patients where it is indicated. And expanding beyond the horizon of infertility is fertility preservation or egg freezing or oocyte freezing. We hear a lot about social or elective freezing now, and we know that so many IVF centers there are egg banks. And why is it happening now? There's a lot of change in the younger generation. Either delayed marriages or the women who want to pursue with their career or education are delaying their pregnancy or a marriage, and they don't want to compromise on their fertility. So in those situations, they are even opting for freezing their eggs and then using them at a later date. So that negates the effect of age when they want to plan for a pregnancy. But there are lots of pros and cons about it. So a woman who wants to go for egg freezing should in fact discuss with their physician regarding this process and decide whether they really should go for this freezing or go for a pregnancy, a natural pregnancy, which definitely is much safer and better than going through these procedures. And who knows whether the woman is going to conceive with this kind of a treatment later or not. And one should not regret later that they have not tried naturally. Nowadays, we come across with young women losing their eggs at an early age. So we don't know the reason for this. We all know about decline in the sperm count all over the world. So it could be all because of the lifestyle changes, the drugs, alcohol, smoking, obesity, underweight, a sleep pattern, a social attitude. There's so many things which could be attributing to this change. So there is a procedure called ovarian rejuvenation. Yeah, you heard it right. It means if a woman has less number of eggs, which reduces the chances even in IVF cycle or in a natural cycle, then we either supplement them with drugs which may or may not work. At the same time, there is a procedure called platelet-rich plasma being injected into the ovaries. So you draw blood from the woman and you try to separate some growth factors from this blood, and these are injected into the ovary the way an egg recovery is done. So this in fact activates some primitive cells in the ovary and may help in improvement in the egg count. So this is still not a completely established treatment, but it is being used for a couple of years, and we also have been using this in our clinic. And surprisingly, we did see change in the ovarian reserve following this procedure. And in fact, we had a couple of patients who conceived naturally during the gap period following this procedure. So we really have to wait and see how much it is going to be useful to improve the egg count in women where there is a loss of ovarian reserve. Nearly 10 to 15% of couples face this kind of difficulty in conceiving. 1 in 6 or 1 in 8 may in fact have to seek a physician's advice. Infertility is on the rising trend. So the male factor is increasing, the number of sperm count is declining, number of eggs in the ovary of a young woman also is getting reduced. This all could be because of the change in the lifestyle. There are some factors which are avoidable, and if the youngsters remember about it, maybe they will reduce the risk of having infertility at their later age. There are some unavoidable factors which nobody can do anything about it. Infertility journey is a long and tedious journey. Most actually feel it as an emotional or a financial burden. So an effective and a transparent communication before embarking onto this tedious journey will help the couple to be mentally and physically prepared. One should be prepared for multiple IVF cycles, or one should be prepared for that negative aspect which can happen for most couples following in any kind of infertility treatment. So most thing IVF is a sure shot treatment and they are going to conceive in the very first cycle. So they should be equally or more prepared for pregnancy not happening and to have that negative result following the first IVF cycle. Though IVF treatment is the one with a very highest success rate, not all need IVF treatment. Most conceive with a simple treatment and most conceive even with just a oral medication. An appropriate treatment at an appropriate time, attempted with patience and perseverance, is what is going to help achieving success. IVF truly is a hope for most of the couples, and this has become fortunately accessible, safer, individualized, and with improved pregnancy rates. There are lots of myths and misconceptions in IVF treatment. The first one is, because it's called test tube baby treatment, they think the baby is born in a test tube. It's not born in test tube, it is still born in the woman's womb. The embryo is in fact grown in the laboratory in a petri dish for just about 3 to 5 days, and the rest actually nature has to take care, and it happens in the mother's womb itself. Some think that test tube baby means using a donor sperm. The main advantage of IVF or test tube baby treatment is that you can use this treatment even in men with a very low sperm count. A procedure called intracytoplasmic sperm injection or ICSI. In fact, you can take a single sperm into a fine needle which is as thin as the diameter of a hair, and it is injected into the egg. So even with a single sperm, you can fertilize an each egg. So very few sperms, you can go for a procedure called ICSI. And we had the first IVF baby of combined state of Andhra Pradesh in 1999 from the first ICSI baby. And it's been used all over the world, not only in male infertility but also to improve the pregnancy rates. There are some women with no sperm count at all, which is called azoospermia. In those situations, the sperms are even taken from the testis and they are matured, they are frozen, and then they are used for ICSI procedure later. So it does not mean a donor sperm, it means using a husband's sperm even if the counts are very low. The other concern is it safe to go through IVF? There are many couples, or in fact the husbands keep asking the question after every consultation, that are there going to be any side effects for my wife? I don't want to go through an IVF, it's going to cause a problem to her. IVF has become much safer with lesser side effects, and it has become more effective. But it does not mean that no one can have any side effects or any problems with any kind of treatment. It involves a procedure where there is a small risk with anesthesia, a small risk with the procedure, but with all these refinements, we normally do not come across with any kind of problems during a procedure. So it has become very minimal. And the drugs also, one of the major risks was hyperstimulation syndrome, which has really become very lessened and the risk has become very less. So one need not worry too much unless the woman or the couple has some medical complications where the risks are higher. Then the physician would actually advise you regarding the alternate options or to stop treatments for you completely. The other misconception is that, is the baby going to be healthy? Is it going to be normal? Baby is going to be as healthy as any other baby following a natural pregnancy. The risk of congenital anomalies, which is about 3 to 5% in a general population, remains the same even following IVF. We have seen our babies to be much intelligent, more active. So I don't really think that it's going to increase the risk in a major incidence. So it is quite safe and it does not increase any risk to your baby. So you can in fact carry on with IVF with confidence. Only worry is those who have a genetic factor in the couple, then this can be passed on to the baby. Then the risk for the baby of a genetic abnormality is increased. Otherwise, the risks are the same as in a normal population. What are the success rates in IVF? Everybody thinks that IVF is going to be 100% success rate. It's not so. The pregnancy rates are 30 to 40% in each cycle in the best of the circumstances, and by the end of 3 or 4 cycles, we expect 90% to conceive. And in fact, we have also seen conceptions following IVF during the gap period also. So don't get discouraged if you do not conceive in IVF. You still may have a chance of conception on your own naturally. In IVF treatment, because we freeze the embryos and use it later, many question, is the frozen embryo transfer going to be better or is it a fresh cycle? Once you have frozen the embryos and thawed them, depending on the quality of the embryo, the pregnancy rates are going to be as or equivalent to a fresh embryo transfer. It's the same whether you go for a frozen embryo transfer or a fresh embryo transfer. The only hitch in this is, suppose you freeze 4 or 5 embryos, not all may reach up to a stage of blastocyst or not all may survive a freeze-thaw procedure. Only the good quality embryos survive a freeze-thaw procedure. So you may have a lesser number of embryos than what we started with after freezing, but once you transfer the good embryos, the pregnancy rates are the same as when gone for a fresh embryo transfer. Many couples think that following IVF there are going to be twins and triplets always. It's not so. It depends on how many embryos are transferred. In the early days, we were doing embryo transfer using 2 or 3 embryos, but now it has minimized to a single embryo transfer. You try to select the best embryo and do a transfer, then the pregnancy rates are good, and at the same time you reduce the risk of having twins or triplets. So you don't see so many twins and triplets around as what we were seeing before. There is a small risk that one single embryo can divide on its own and then it can form as a monochorionic twins, which nobody has a control on. Otherwise, you can reduce the risk of multiple pregnancy by doing a single embryo transfer, especially in women who come for a secondary infertility. That means they have already a child and they're coming for a second child. So it's always essential that you do a single embryo transfer for them.
If you know of any couple who are unable to conceive within 12 months of trying, please encourage them to seek help from medical experts. Let the reach of scientific advances in reproductive health spread to all corners of the country and bring joy to all such couples. This public awareness message aimed at spreading awareness on infertility and its treatment is brought to you by Novelty Health Shine.